Question 1. During a routine clinic appointment, the nurse checks the vision of a 7-year-old child. The nurse tells the parents to follow up with an optometrist, because the child seems to have myopia. Another term for this is B. Nearsighted. Myopia is the medical term for nearsightedness. Farsightedness is the common term for hyperopia. Strabismus and NBSB, or tropia, are the and NBSB medical terms, and NBSB, for and NBSB, an eye and NBSB, condition commonly called wandering eye or cross eyes. Amblyopia is the term for lazy eye. Question 2. Before postpartum discharge of a Latina mother and her healthy newborn, the mother tells the nurse that she will soon begin to feed the infant cured foods. The nurse recognizes that the most likely reason for this is C. The mother is following her cultural beliefs. Studies show that Latinas are more likely not to exclusively breastfeed or give formula. They are also more likely to introduce solid foods earlier than current guidelines. There is a cultural tendency to see chubby babies as healthier and stronger. The nurse may not be able to affect the mother's practices at this time. However, the nurse can offer as much education as possible. The nurse can also explain some risks of offering solid food early, including choking and childhood obesity. Question 3. At a senior citizen health fair, the nurse offers to administer influenza vaccinations. The nurse explains that people over 65 years old should get an annual flu shot because A. Their immune systems have become weaker. The CDC guidelines for people over age 65 include an annual flu vaccination before the end of October. With weaker immune systems, older citizens are at risk for more complications if they get the flu. The CDC also recommends a shot rather than a nasal spray vaccine. The other options are not correct. Question 4. During Men's Health Awareness Month, the nurse conducts a community workshop on how to perform a monthly testicular self-examination, TSE. The nurse emphasizes that the best time to perform a TSE is after showering. What is the rationale for this? C. The scrotum will be easier to palpate. Following a warm shower, testicles will be lower and easier to palpate. Nudity is not an automatic reminder to do a self-examination. Cool temperatures cause the testicles to retract and become firm, making them more difficult to palpate. TSE should not be painful. November is Men's Health Awareness Month. The Movember Foundation uses the month to raise awareness and support of those tackling prostate cancer, testicular cancer, mental health, and suicide. Question 5. On the third postpartum day, the color of the lochia discharge is typically B. Rubra. Lochia and NBSB is the vaginal discharge after giving birth, containing blood, mucus, and uterine tissue. There are 3 types of lochia: rubra, red or red-brown, which lasts up to 7 days, serosa, pink, which lasts up to 2 weeks, and alba, white, which lasts up to 6 weeks. The colors should not reverse. Mucus is not a type of lochia. Question 6. At a community health fair, a nurse gives a presentation on colorectal cancer. The nurse is asked about prevention and screening. Which statement by the nurse is most accurate? B. At age 50, if you're at average risk, you should get a complete screening every 10 years. Unless there is a personal or family history of colorectal cancer, a regular complete screening, colonoscopy and fecal occult blood testing, can start at age 50. Dietary recommendations include high-fiber and low-fat foods. Question 7. The community health nurse is developing a program for clients who are victims of intimate partner violence, IPV. The nurse knows that identifying IPV victims is challenging because B. Clients only express minor, vague complaints. Intimate partner violence, IPV, is physical violence, sexual violence, stalking, or psychological harm by a current or former partner or spouse. This type of violence can occur among both heterosexual and same-sex couples and does not require sexual intimacy. IPV is common. About 1 in 5 females and 1 in 7 males experience severe physical violence from an intimate partner. IPV victims may express only minor complaints, such as headaches, GI issues, insomnia, or mild muscle aches. However, they seek medical attention more than non-victims. Clients in abusive relationships are usually aware of their situation and possible resources, but they may fear retaliation if they seek help. The cost of legal action is not a factor in lack of identification. Question 8. The nurse is giving a presentation to a group of parents on how to protect children from lead poisoning. The nurse stresses that a common source of lead is B. Old paint. According to the CDC, lead-based paints are the most common source of lead poisoning. The paints were banned for residential use in 1978. Homes built in the United States before 1978 are likely to have some lead-based paint. As the paint peels and cracks, it makes lead paint chips and dust. Approximately 24 million housing units have significant lead-based paint hazards, including deteriorated paint and lead-contaminated house dust. About 4 million of these units are home to young children. Question 9. The nurse is doing discharge education for a patient with newly diagnosed congestive heart failure, CHF. The nurse tells the client to weigh himself or herself every morning and notify the clinic if they have gained 2 pounds in a 24-hour period. The nurse knows that such a weight gain can indicate C. Decreased cardiac output. Decreased cardiac output can lead to fluid retention because the renin-angiotensin-aldosterone cycle has been stimulated. Excessive calorie intake can lead to weight gain but not usually in a 24-hour period. There is no indication of poor kidney function or impending liver failure. Question 10. During a routine checkup, the pediatric nurse observes that a 5-year-old boy is stuttering when he tells the nurse about his recent holiday. What is the nurse's most appropriate action? B. Obtain a referral for a speech pathologist. The child should be referred to a speech and language pathologist, SLP. The role of an SLP is to assess, diagnose, and treat speech, language, social communication, cognitive communication, and swallowing disorders in children and adults. Developmental stuttering occurs between 2 and 5 years. It may happen when a child's speech and language development lags behind what they need or want to say. The exact cause is unknown, although it is common in some families. It is different from neurogenic stuttering, which occurs after a stroke or brain injury. Psychogenic stuttering is rare, happening after emotional trauma. Child abuse is not a factor in developmental stuttering. Although the child's hearing should be evaluated, it is not the first action. Question 11. A client is placed on a low-sodium diet because of hypertension. Which item should the client avoid? C. Soy sauce. Soy sauce is high in sodium. The client should also avoid garlic and NBSB, salt, onion and NBSB, salt, MSG, meat tenderizers, broth mixes, teriyaki and NBSB, sauce, barbecue and NBSB, sauce, sauerkraut, olives, pickles, pickle relish, bacon bits, and croutons. Note: garlic powder and onion powder may be used. Question 12. Following the birth of her first child, a 27-year-old makes an appointment to discuss oral contraception. During the assessment, the client discloses a family history of heart disease. What question should the nurse ask next? C. Are you a smoker? If a woman has risk factors for heart disease, oral contraception can compound the risk. Women over age 35, smokers, and women with high blood pressure, diabetes, or unhealthy cholesterol levels are most at risk. With a family history of heart disease, the client may not be a suitable candidate for birth control pills if she is a smoker. Question 13. A nurse is educating the parents of a 9-year-old girl who will be undergoing chemotherapy. The nurse explains that alopecia is a side effect. Which statement by the nurse is most appropriate? C. She should choose a wig that's similar to her own hair now. It's important for the child to continue looking as much as possible as she always has. A wig will provide her with both a positive appearance and a way to adjust to her hair loss. During chemotherapy, hair often falls out in clumps, creating a patchy baldness that is noticeable. Parents and others close to the child do get used to the baldness, but it can still be disturbing and a reminder of the situation. Question 14. When an outbreak of fifth disease occurs at an elementary school, the principal asks the school nurse to give a presentation to teachers and staff on how to prevent spreading the disease. Which of the following should the nurse include in the presentation? B. Teach and enforce proper hand hygiene. Fifth disease and NBSB is caused by a virus called parvovirus B19. The virus is spread by droplets in the air of saliva, sputum, or nasal mucus when an infected person coughs or sneezes. Most and NBSB, children with and NBSB, fifth disease and NBSB, catch it at school or daycare. Fifth disease, also called erythema infectiosum, got its name because it was fifth in a list of historical classifications of common skin rash illnesses in children. Incubation lasts about 7 to 10 days, up to 14 days. The spread of the virus can be prevented by following good hand hygiene and teaching children to cough or sneeze into tissues or their elbow, then washing hands. Food, school supplies, and common objects should not be shared. The child develops the characteristic slapped cheek rash. When the rash appears, the child is no longer contagious. Children should play outdoors as much as possible. It's easier for the virus to spread indoors, where people are likely to be in closer contact. Preventing the spread of the virus is difficult because people are contagious before the rash appears. The symptoms are like a mild cold, runny nose, headache, and low fever. Koplik spots are characteristic of measles. Question 15. For an elderly client who is learning self-care, which chair is best for managing hip pain from rheumatoid arthritis? B. A straight back chair with a raised seat to decrease flexion. Clients with rheumatoid arthritis experience less discomfort and stiffness when their bodies are in proper alignment and their joints are supported. Hip pain is best relieved by using a straight back chair with a raised seat. This decreases hip flexion and stress on the hip joints. Question 16. A 15-year-old male asks the school nurse for information on safe condom use. Which of the following statements should the nurse emphasize? B. Leave a half-inch space at the tip of the condom. A condom should be applied after the penis is erect. When applying the condom, a half-inch space should be left at the tip to collect the ejaculate and prevent tearing. Condoms should be stored in a cool place because they can be damaged by heat. Petroleum jelly weakens a condom. Mineral oil can destroy a condom within 60 seconds. Question 17. When a nurse is educating a pregnant client on taking iron supplements, which statement by the nurse would be correct? B. Your stools will appear black. Because the client's iron intake will be increased during pregnancy, the nurse should advise the client to expect her stools to appear black from iron that isn't absorbed. The client may also experience constipation, not diarrhea, from the iron. Thin hair and skin rashes are not side effects of taking an iron supplement. Question 18. A nurse is giving an educational session to newly diagnosed diabetics and their families. She starts by explaining that the organ responsible for insulin secretion is the B. Pancreas. The pancreas is the organ that produces and secretes insulin, which regulates blood glucose levels. Beta cells, B cells, produce the hormone insulin and are the most abundant of the islet cells. Alpha cells, A cells, secrete the hormone glucagon. The spleen is the largest organ in the lymphatic system, responsible for balancing body fluids. The gallbladder is a small organ that stores bile. The thyroid is an endocrine gland that plays a major role in metabolism and growth. Question 19. Before a client is discharged after treatment for leg trauma, the nurse instructs the client on the tripod position when using crutches. Which is the proper distance for placement of the crutch tips? B. 6 inches to the front and side of the toes. The tripod position is a stable standing position, providing a base of support and balance. The client places the crutch tips 6 to 10 inches in front and to the sides of the toes, depending on body size. Weight is assumed by the unaffected leg. After the client learns to stand, the nurse can proceed to teach proper gait when using crutches. Question 20. When teaching a client how to change their colostomy appliance, what should the nurse recommend for cleaning the skin around the stoma? C. Plain tap water. Warm tap water should be used to clean the skin around the stoma. Alcohol wipes can dry and irritate the skin. Both soap and baby wipes can leave a residue on the skin that can interfere with the adhesion of the appliance. Question 21. During a prenatal class, the nurse educates parents about keeping their newborn healthy when visitors meet the baby. Which vaccination is most important to receive before having close contact with the newborn? B. Tetanus, diphtheria, pertussis. Visitors, caregivers, grandparents, or others who have close contact with a newborn should have current routine vaccinations to prevent spreading diseases before the infant can be vaccinated at about 2 months. Whooping cough, pertussis, is most dangerous for infants. The CDC recommends whooping cough vaccine, DTaP for children and STAP for preteens, teens, and adults. Annual flu vaccinations are also important and should be received at least 2 weeks before close contact with a newborn. Question 22. A primigravida comes to the prenatal clinic for a routine checkup. The healthcare provider, HCP, examines the client and tells her that her pregnancy is normal and her fundus is at the level of her belly button. When the client asks the nurse to explain, what is the nurse's best response? C. You are at 20 weeks. Fundal height is measured from the symphysis pubis to the fundus. The symphysis pubis is a cartilage joint located between the pubic bones. The fundus is the top portion of the uterus. At about 12 weeks in pregnancy, the fundus is in almost the same level as the pubic bone. By 20 weeks, the fundus is at the belly button, umbilicus. This is the time fundal height and week of pregnancy begin to match one another, with a range of plus or minus 2 centimeters. At 36 weeks, the fundus reaches the sternum, breastbone, its highest level. After 36 weeks, fundal height can decrease as the fetus engages into the pelvis. Question 23. Regarding levels of prevention, primary, secondary, tertiary, in community nursing, which intervention or action is an example of a primary prevention strategy? B. Instruction of a 5th grade class on the negative impact of substance abuse. Primary prevention strategies begin in childhood, so educating 5th graders on the consequences of substance abuse is the best choice here. Referral to a halfway house is a tertiary intervention. Intervention with a troubled teen is a secondary intervention. The PTSD client should be referred for treatment. Question 24. After an adult sibling suddenly dies from a heart attack, a client comes to the cardiac clinic because they worry about having coronary artery disease, CAD. The client smokes, and is motivated to learn about smoking cessation. Which of the following findings from the client's examination is the most significant regarding the client's risk? A. BMI of 31. This client already has two important risk factors for having coronary artery disease: a family history of heart attack, and smoking. Obesity, BMI and GT, 30, is a risk factor. Other risk factors are hypertension, high cholesterol, diabetes, lack of exercise, and excess alcohol intake. Hypertension is diagnosed when the systolic blood pressure readings on 2 days is greater than or equal to 130 mm of mercury or the diastolic blood pressure readings on both days is greater than or equal to 80 mm of mercury. Normal cholesterol in adults is less than 200 mg per deciliter. A1C is the average of blood sugar over 3 months. Normal is NDLT, 5.7%. Aside from a genetic predisposition, all the other risk factors can be minimized. Question 25. During a routine checkup of her 2-year-old son, the mother tells the nurse proudly, "He loves to drink milk. I give him as much as he wants." The nurse should counsel the mother and tell her that more than 3.5 cups of milk per day can lead to A. Iron deficiency. Eating or drinking an excess of any food can lead to a nutritional deficiency, because the diet becomes unbalanced. If this child drinks too much milk, he won't be as hungry for other foods, and he won't be exposed to a variety of tastes. Dietary iron aids early brain development. An iron deficiency can permanently affect psychomotor development. Question 26. A mother calls the pediatric clinic to report that her 3-year-old child has diarrhea. She asks how to manage it at home. What should the nurse suggest? A. Continue the child's usual diet as tolerated. The American Academy of Pediatrics recommends continuing the child's usual diet to maintain the electrolytes and complex carbohydrates found in a balanced diet. The other options, including the popular brat diet, bananas, rice, applesauce, and toast, are lower in electrolytes. The nurse should also ask the mother to describe the diarrhea in terms of frequency and appearance, to determine what the mother means by diarrhea. Question 27. A client who is 9 weeks pregnant comes to the OB clinic for her first prenatal visit. The nurse takes the client's medical and social history, noting that the client admits to daily consumption of alcohol. The nurse should educate the client about alcohol use during pregnancy in order to A. Reduce the risk of teratogenic effects to the developing fetus. During the first trimester, the organs and systems of the fetus are developing. Drinking alcohol during pregnancy can cause miscarriage, premature birth, stillbirth, and lifelong physical, behavioral, and intellectual disabilities. The disabilities are known as fetal alcohol spectrum disorders, FASD. Women who consume alcohol during pregnancy have a 33% greater likelihood of placental abruption, not placenta previa. Many women do not adapt to the idea of becoming a mother until the second trimester. Question 28. During a community class for senior citizens, the nurse explains advance directives. A man asks about appointing someone to be financially responsible for his healthcare decisions if he is unable to be. The nurse tells him that person would be his C. Healthcare power of attorney. The healthcare power of attorney has responsibility for financial decisions connected to healthcare. This person approves charges and handles all financial matters when the client is unable to do so. The other options are not authorized to deal with finances. Question 29. After a cesarean section delivery of a healthy boy, the nurse knows that he will be observed carefully, because he may be at risk for C. Breathing difficulty. With A and NBSB, cesarean section, C-section, delivery and NBSB, babies and NBSB, don't and NBSB, get and NBSB, the thoracic squeeze from coming through the birth canal, so they will and NBSB, have and NBSB, extra fluid in their lungs to contend with. This may mean that they experience and NBSB, difficulty breathing or coughing up extra fluids during the first few days. Cold stress occurs when the infant is not dried and kept warm. All neonates are dried and placed under a warmer. The other options pose no greater risk for C-section babies than for those born vaginally. Question 30. An hour after the vaginal birth of a term neonate weighing 10 pounds 8 ounces, 4,763 gm, which of the following should the nurse monitor closely? C. Hypoglycemia. A neonate weighing more than 4,000 g is considered large for gestational age, LGA, and at risk for hypoglycemia, caused by the rapid depletion of glycogen stores. Hypobilirubinemia may develop if bruising occurred during delivery, but it will not be apparent at 1 hour post-birth. Question 31. During his shift in the emergency department, the nurse assesses a 7-year-old boy with fever, vomiting, and seizures. The boy's mother tells the nurse that they have no health insurance. The nurse reassures the mother that emergency services will be provided regardless of the family's ability to pay. This right to treatment is provided by B. The Emergency Medical Treatment Act. The Emergency Medical Treatment and Labor Act, EMTLA, is a federal law that requires anyone coming to an emergency department to be screened, stabilized, and treated, regardless of their insurance status or ability to pay. It's also called the Anti-Dumping Law, enacted by Congress in 1986 as part of the Consolidated Omnibus Budget Reconciliation Act, COBRA, of 1985, 42 U.S.C. Section 1395 dd. EMTLA defines an emergency medical condition as a condition manifesting itself by acute symptoms of sufficient severity, including severe pain, such that the absence of immediate medical attention could reasonably be expected to result in placing the individual's health, or the health of an unborn child, in serious jeopardy, serious impairment to bodily functions, or serious dysfunction of bodily organs. Question 32. When reviewing the lab results of a neonate born 12 hours ago, which serum value should the nurse immediately report? B. Glucose 28 mg per deciliter. Neonatal hypoglycemia is defined as a plasma glucose level of less than 30 mg per deciliter, 1.65 millimoles per liter, in the first 24 hours of life and less than 45 mg per deciliter, 2.5 millimoles per liter, thereafter. The normal range for hemoglobin in the newborn is 17 to 19 gdl, 17.2 gdl. The normal range for platelets in the newborn is 150,000 to 400,000 mm³, 250,000 mm³. A white blood cell count of 18,000, 40,000 mm³ is normal in the newborn. Question 33. After completing infertility evaluations, a husband is diagnosed with a low sperm count. The nurse assesses his understanding of possible causes. The nurse knows more instruction is needed when the client says, C. My scrotum temperature is too cold. Heat, not cold, can lead to a low sperm count. When the temperature of the scrotum is elevated, sperm can be destroyed. Clients may be advised to wear boxer shorts to keep the scrotum away from the body's core heat. The other statements are possible causes of a low sperm count. Question 34. A pediatric nurse assesses a 2-year-old girl at a routine visit to the clinic. Which finding would most indicate a developmental delay? D. The child has no language skills. Unless they have a hearing deficit, 2-year-olds should be able to express themselves with even a few words, such as no or mine. They should also be saying basic sounds, like mama and dada. Toilet training and transitioning to a cup may start at this time, but they are more reflective of parenting styles. Drawing begins with scribbles. Drawing a face is too advanced for a 2-year-old. Question 35. An 8-year-old child is recovering in the hospital from a surgical procedure. When the child tells the nurse they are bored, which of the following activities is best for the client? D. Playing video games. Playing video games is a fun and challenging activity for a school-age child. A school-age child, about 6-10 years old, is interested in hobbies and skill-oriented activities. They can become competitive and focused on performance. Friendships, especially with the same gender, are important. Video games and board games can entertain a school-aged child. Keeping a journal is an activity for an adolescent. Playing with wooden blocks is appropriate for a toddler or preschooler. Crossword puzzles are too advanced for an 8-year-old. Question 36. When a nurse develops the care plan for a client with a diagnosis of osteoarthritis, OA, which outcome is the priority? D. Preserve functional ability. Osteoarthritis, OA, is a progressive condition, manifested by deterioration and loss of cartilage and bone in one or more joints. Clients with a diagnosis of OA should aim to preserve or improve their mobility functional status to allow them to live independently. This may include using assistive or ambulatory devices for as long as possible. The other answer options may also be part of the care plan. They support the primary goal of preserving the client's joint function. The nurse can include interprofessional team members, such as physical therapy, occupational therapy, and nutrition services as indicated. Question 37. The community health nurse is giving a presentation on osteoarthritis, OA. Which of the following does not contribute to the development of osteoarthritis? D. Autoimmune process. Osteoarthritis, OA, is caused by mechanical wear and tear on joints. Contributing factors to its development are the aging process, obesity, previous joint injury or damage, and repetitive use of the joint. By 40 years of age, 90% of the population has degenerative joint changes in their weight-bearing joints. Prevalence of OA is between 50% and 80% in the elderly. Rheumatoid arthritis is an autoimmune disease in which the body's own immune system attacks the joints. Question 38. A pharmacist is giving a presentation to nursing students on pharmacokinetics in older adults. Which physiological change related to aging increases the risk of drug toxicity? D. Body fat increases and total body water decreases. With age, body fat generally increases and total body water decreases. Increased fat increases the volume of distribution for highly lipophilic drugs, e.g., diazepam, chlordiazepoxide, and may increase their elimination half-lives. Aging results in several significant changes in the human liver, including reductions in liver size, blood flow, and drug metabolizing enzyme content. Drug metabolism is also influenced by comorbid disease, frailty, concomitant medicines, and genetics. Serum albumin decreases with age. Phenytoin and warfarin are examples of drugs with a higher risk of toxic effects when the serum albumin level decreases. One of the most important pharmacokinetic changes associated with aging is decreased renal elimination of drugs. Question 39. A cardiac nurse is teaching a client who has just been prescribed digoxin, lanoxin. To help prevent complications from the medication, which of the following should the client measure and record? D. Daily pulse. Digoxin, lanoxin, cardoxin, is a cardiac glycoside used for heart failure and atrial fibrillation. It makes the heartbeat stronger and with a regular rhythm. The client should measure and record their pulse daily. The client should report a pulse that is less than 60 bpm or greater than 100 bpm. The other measurements are not necessary. Question 40. A mother brings her 3-month-old infant to the pediatric clinic for a routine checkup. She tells the nurse that breastfeeding has gone well until the past week. She doesn't seem to be producing enough milk to satisfy the baby. What is the nurse's best response? D. Nurse more frequently during these growth spurts. Infants commonly have a growth spurt at about 3 months, so more frequent feedings will stimulate milk production. Solid foods are generally not introduced until 4 to 6 months of age. Supplemental formula and restricting feeding times will not increase the mother's milk supply. Question 41. The nurse is teaching a new hemodialysis client how to monitor fluid status between dialysis treatments. Which is most important for the client to record daily? D. Intake, output, weight. Clients on hemodialysis should be taught to monitor their fluid status by measuring and recording their intake, output, and weight every day. When a client is on dialysis, their fluid intake is restricted because the kidneys are unable to remove excess fluid. Too much fluid increases blood pressure and can lead to cardiac or respiratory distress. The other 3 options are not necessary. Question 42. After learning that his sibling has been diagnosed with lung cancer, a client tells the nurse that he wants to quit smoking. What is the first action that the nurse should suggest? D. Make a plan to quit smoking. When a client wishes to quit smoking, the nurse should encourage the client to make a plan, including a quit date within the next 2 weeks. During that time, the client can inform family, friends, and coworkers, research and make a list of what will happen when quitting, and what to do to avoid tempting situations. A contract isn't useful. Question 43. A multipara who is 24 weeks pregnant calls the obstetric clinic to report bright red, painless vaginal bleeding. Which test will the client likely receive? D. Transvaginal ultrasound. Placenta previa is diagnosed through ultrasound, either during a routine prenatal appointment or after an episode of vaginal bleeding. The most common symptom of placenta previa is bright red, painless bleeding from the vagina. Placenta previa can cause bleeding late in pregnancy. Most cases of placenta previa are diagnosed during a second trimester ultrasound exam. Amniocentesis is used to diagnose chromosomal disorders and open neural tube defects, such as spina bifida. Human chorionic gonadotropin, HCG, is a hormone produced during pregnancy. It appears in the blood and urine of pregnant women as early as 10 days after conception. Chorionic villus sampling, CVS, involves taking a sample of the placental tissue to be tested for chromosomal abnormalities and some other genetic problems. Question 44. The nurse is doing discharge teaching for a client who is status post-total hip arthroplasty. The client should be instructed to do all of the following except: D. Apply cream to the incision every day until the sutures are removed. The client should be instructed to place a dry dressing on the hip incision once or twice a day. Showering is usually permitted after 4 to 5 days. The incision should be patted dry. No creams or ointments are permitted before 6 weeks post-op. The other instructions are all appropriate. Question 45. A nurse is leading a prenatal workshop on a healthy pregnancy. One of the participants asks about smoking during pregnancy. The nurse states that smoking puts the baby at risk for D. Low birth weight. Women who smoke during pregnancy are at risk for miscarriage and preterm labor. The fetus is at risk for low birth weight. Compared with babies born to non-smoking mothers, the mean birth weight of babies whose mothers smoked 6 to 10 cigarettes a day during pregnancy was 320 gm lower, and 435 gm lower for babies whose mothers smoked 11 or more cigarettes per day. Smoking is harmful to the mother's vascular system but is not linked to fetal heart anomalies, fetal birth defects, fetal anemia, or fetal nicotine withdrawal.